and Metro Council. Before us, we have the Health Department. We have Dr. Wendy Long. I'll let you do the introductions, and you can walk us through the budget. The floor is yours.
Thank you. Good afternoon, Madam Chair and council members. We appreciate the opportunity to be here today to present the recommended fiscal year 20 budget for the Metro Public Health Department. I am Wendy Long, the Health Department Director, and here with me today is Dr. Sammy Areola, our Deputy Director, and Jim Diamond, our Director of Finance and Administration. There are also a number of other members of our team out in the audience should we need their help in answering any of your questions. And I very specifically want to acknowledge that the chairman of the Board of Health is here, Carol Etherington, to support us today. We appreciate you being here. Let me begin by saying that we are on track to achieve our targeted savings for the current fiscal year, and we will be able to operate within the budget that's been recommended by the mayor and that's before you today. It is essentially a status quo budget with the exception of the cost of living increase, which we are very grateful for. I am relatively new to my position with the department, but I've already had the opportunity over these last 2.5 months to start to get to meet and interact with many of our staff, and I've been incredibly impressed with the talent and passion of our team at the health department. And I wanted to take a few minutes today to highlight some of what they have been involved with and accomplished over the course of the last year. As you know, core to our mission in public health is protecting and improving the health of Davidson County residents. And we protect the health of the population through 3 primary types of services. The first are the activities that we undertake to try to prevent the spread of infectious disease. So this would include things like disease outbreak investigations or our efforts to try to improve immunization rates across the county. Second are our regulatory functions. This would include our inspections of restaurants and hotels, swimming pools, tattoo and body piercing establishments, a wide variety of facilities, as well as our efforts around air pollution, where we're involved with permitting and inspections. So these are basically efforts to protect the public from environmental health threats. A third component of what we do that I think is crucial to our mission to protect the health of the public are the efforts of Metro Animal Care and Control. MAC is involved in both protecting humans from potential dangers from animals, but as well as protecting our animal residents from potential abuse and neglect from humans. I want to touch on just a few achievements related to protecting the health of the population in this last year. The first would be our response to the hepatitis A outbreak. As you know, hepatitis A is a vaccine-preventable disease that can cause serious illness. The people who are most at risk are people who use drugs, men who have sex with men, and individuals who are experiencing homelessness. And it was almost exactly a year ago that we first recognized and announced the fact that we had a hepatitis A outbreak in Nashville. Over the course of the last year, we have worked with community partners to really conduct a lot of outreach to these 3 at-risk populations, and as a result have been able to provide free vaccinations to some 12,600 people. And the really good news is that we're beginning to see the results of those efforts and that we can clearly see a downward trend in the numbers of new cases that we're seeing each week. So that's great news. I think another area where we really have something to celebrate is around the work of Metro Animal Care and Control. Last year, they achieved a 90% save rate for dogs and cats in the shelter, and that is a milestone, an incredible milestone. It's the best that we've ever done, and it is a huge improvement from just 5 years ago when our save rate was around 46%. So I cannot commend enough the staff who work at MAC, the volunteers who assist them, and the community partners. It has really been the collaborative effort of all of those groups that have made that possible. sort of shifting from the protect function of public health to our role in improving the health of populations. We do this through services that we deliver directly to individuals and families, as well as through community partnerships that are intended to address population health issues that are beyond the ability of any single entity to tackle or effectively tackle. Relative to our interaction with individuals and families, the health department operates a number of different programs that are designed to facilitate access to care or coordinate needed health and social services for individuals. Most of those programs target specific population groups like pregnant women or children or individuals living with HIV. In addition, we deliver preventive health services directly in 4 different clinic locations that are located throughout the county. Last year, we had over 100,000 visits to our clinics to receive healthcare services. Those services run the gamut from nutrition services through the WIC program to immunizations, family planning services, the treatment of certain infectious diseases, as well as dental care. And in addition to the services that we offer in those clinic locations, we provide services in the schools through the school nurse program and through a school-based dental program. Last year, our dental staff in schools saw over 6,000 students in 46 schools and applied over 17,000 dental sealants, which are designed to prevent the development of cavities. And our school nurses saw on average 5,000 students a day for office visits, as well as provided a very wide variety of healthcare procedures that range from medication administration to tube feedings to very complex procedures like tracheostomy care. Complementing our efforts to improve health through those services to individuals are the partnerships that are so critical to addressing complex public health issues like the opioid epidemic or the health inequities that we see across population groups. And so the health department frequently serves as a convener and a facilitator for numerous such partnerships, including the work this past year of the Ending the Epidemic Task Force, which has developed a plan to significantly improve health outcomes for individuals living with HIV in our community. As well as the collaborative efforts in the behavioral health space that led to the opening this year of the state-of-the-art treatment facility at the Mental Health Co-op, which has greatly reduced demand on our emergency rooms, as well as provided police officers with the ability to get individuals into treatment rather than having to take them to jail. So that's kind of just a brief summary of what all we're involved with and some of the, I think, successes that we've had in the last year, and I'd be happy to take any questions.
Thank you so much, Dr. Long. Vice Chair Roten.
Thank you, Madam Chair. Thank you, Dr. Long, for being here. I appreciate it. Since I know your background, I'm going to ask you a question. I know you've only been there for 2.5 months, but are you seeing any avenues at the Metro Department of Health where Medicaid dollars could be used that they have not been used previously? And do you think there may be some ways to get Medicaid dollars for those? And you don't have to tell me now if you think we'd like to talk later about that, but I always just like to know if you see any ways that we can get more revenue for our Department of Health. Thank you.
That's a great question, and I do have something that I'm going to be pursuing with the Bureau of TennCare. I'd rather not talk too much about it just yet, but I think there is some potential.
Thank you. I look forward to that.
Thank you, Vice Chair Roten. Any other council members seeking recognition? Councilwoman Henderson.
Thank you, Chair Vercher. I was looking at your non-program revenue, I guess in taxes, licenses, and permits, and seeing that was down about $150,000. Is that related perhaps to rabies going to every 3 years, or I just wondered if there was a specific reason for that.
I do know that we are seeing some decrease in rabies tags as a result of going to every 3 years, but I believe we charge 3 times more for the 3-year tag. So
okay.
Yes. Were you speaking of animal control specifically?
Well,
or-
no, I apologize. I was just looking in your special purpose fund, your non-program revenue, taxes, licenses, and permits. It was just down 40% or 150,000. And I was just, it just brought to mind actually the new procedure related to the rabies vaccinations, but it might not be related, so.
No,
it-
the special purposes in the grants, we did see some reductions in some of our grants.
Okay, so it's,
so that-
it's
that-
just in the grant space. I apologize, yeah.
that's
I
okay.
guess I was thinking more, probably when I highlighted that, thinking it more about general fund rather than special purpose and grants. But there seems to be a little bit, first and foremost, a special thank you to Metro Animal Care and Control. I think that rate change of pets saved is really remarkable over 5 years. I think they've done such an exceptional job in marketing, frankly, and kind of elevating the community's perception of that is a place to go and get a dog. And so I would remind all departments of Metro that marketing matters, and I think you're really seeing it there. But as it relates to, I think, my question about the rabies vaccination or permit that was perhaps misplaced, I do hear a little bit of confusion in the community about kind of how that works now, and if the tag actually reflects the year span. And, you know, a dog will, or a pet that's vaccinated, that will be at any particular point in the year, so the tag doesn't necessarily reflect when it, but I didn't know if there might be a little bit more education in that space, or maybe a little bit of changing the text that's on the actual permit. Just having done that recently with my own dog, posed a question to my veterinarian. I wasn't clear, they weren't very clear. I just don't know if maybe a little bit more education needs to be done around why we made that change and just what animal owners are supposed to do.
We could certainly work on providing some additional education. The tag, assuming it's the Metro tag,
Right.
whether it's a 1 year or 3 year, does represent everything the pet owner needs to do in terms of registering their pet, as well as demonstrating that they have the rabies vaccination. And I believe the span depends on the date at which you get the vaccination, but we can definitely work on providing some additional information.
And does the tag, though, reflect the span, or does the tag still just reflect the year in which the pet was vaccinated?
I believe the tag indicates whether it is a 1 year or a 3 year tag, and my
Okay, thank you. The tag indicates that. Thank you.
Councilwoman Hurd.
Thank you, Madam Chair, and I wanted to thank Dr. Long and the team for all of the wonderful work that they do. And I don't have any questions, but I really wanted to give you all a shout out with the work that you've done to assist community organizations. And I know you talked about it a little bit, but I wanted to publicly announce that the Health Department helped StreetWorks dispose over 120,000 dirty needles through its syringe services program. And when you talk about ending the epidemic, that is significant and could not have been done without you, and we just wanted to thank you so much for it.
thank you, Councilwoman. We appreciate that.
Thank you, Councilwoman Hurd. Councilwoman Henderson.
Thank you, Chair Vercher, for recognizing me again. I apologize. I did forget one question. Could you share with us, I know so many of your positions and work efforts are supported through grant funding. Do you kind of have a breakout of, from a staffing perspective, how many positions are funded through grants and what that means kind of proportional to your overall staff?
I believe 53% of our budget is grants.
Grants, okay.
And looks like 236 positions are locally funded and 268 are grant funded.
Thank you very much.
Thank you, Councilwoman Henderson. Director Long, just quick question that I have. The school nurses, that's still coming out of your budget, correct? The schools isn't absorbing that?
So the largest part of the school nurse budget comes to us through the schools, but a smaller component that I think was appropriated maybe 2 years ago comes directly to us.
Okay, just wanted to make sure no changes in that.
Yep.
Any other council members seeking recognition? Okay, seeing none, thank you so much, Dr. Long, for you and your team and everything that you do for this great city. This concludes your budget hearing, and if we can have MTA, you can begin making your way down. Thank you so much.